The Tropical Health and Education Trust, in collaboration with various health sector stakeholders, has highlighted the escalating issue of antimicrobial resistance (AMR), which is claiming lives.
As government, of course, we are still building capacity, but it may not have reached up to the community level of health center for some of the laboratories are weak. You understand? But all regional referral hospitals, even general hospitals, should be able to do what we call culture and sensitivity tests, so that you can take a sample of pus and see which antibiotics are able to work.
The unnecessary use of antibiotics, particularly in rural areas where self-medication is common, has worsened the problem. In some cases, clinicians often disregard clinical treatment guidelines when prescribing medications to patients.
We want them to follow the treatment guidelines and not do things to please a patient per se, which are outside the treatment guidelines, or be motivated to make more money by prescribing, say, IV drugs, which are more expensive, instead of giving somebody an oral medication, which would work as effectively as the IV.
Frequent stockouts of essential drugs in public facilities, leading to healthcare providers to prescribe based on availability rather than clinical need, is another challenge. The recent executive order by the U.S. President halting U.S. aid activities is expected to worsen AMR, as it may delay access to necessary medicines.
If they cut back the funding, that means you have people are not able to access ARVs in time. You have what we call stockouts. And the moment there is a break in the chain, in the supply chain, then also, by the time somebody gets his ARVs after another 6 months, the virus is it's mutating, it's becoming resistant.
However, if there is a stock out of the recommended treatment, sometimes you find the clinician is forced to prescribe the treatment that is available, other than tell the patient to go home with nothing.
Thet is implementing a stewardship program targeting public facilities to raise awareness among clinical officers about the severity of antimicrobial resistance.
In Uganda, we train more than 1,000 healthcare workers, and we were working in 18 health facilities. These range from national referral hospitals like Kawempe and Chirudu, regional referral hospitals like Entebbe and Lira.
Findings suggest that incorporating MR training into educational programs is crucial as part of the National Action Plan.
Realize that actually we have so many people that are dying because of AMR. So I think the earlier we institutionalize AMR, the better, so that we know who is answerable, who do we answer to, and who gives us the direction in which we implement AMR in our country.
Misuse of antibiotics facilitates the spread of resistant microorganisms, complicating the fight against HIV and AIDS. Komagum Rogers and Abdul Nasir Lubama for UBC.